Hello, everyone, and welcome to our podcast. My name is Gal.
And I'm Andrew.
So today we're going to talk about something that a lot of people talk about, but no one really, I don't know if people actually know what that means. PTSD.
Yep. It's definitely a word that gets thrown around a lot.
Yeah.
So we'll definitely begin by, of course, defining what it is. But yeah, most broadly, our topic is going to be about post-traumatic stress disorder and serving veterans who have experienced PTSD and other forms of trauma.
Yes. So PTSD can go in many populations. You know, many populations can experience that. But today we're going to focus about veterans, military, active soldiers, and we'll dive right into it.
Yeah, and I think first, one thing we wanted to do is talk about why So would you want to first talk about why this topic is important to you, and I could kind of share my experience?
Yes.
Okay.
So not many people know this, but because I'm from Israel, military service is mandatory. And PTSD is something that I don't think many people like to talk about, because soldiers usually have that image of they have to be the heroes, they have to be the strong people. And having symptoms that we're going to talk about later, it's weak, you know? So again, PTSD can be in so many populations, but today we're going to focus about soldiers. But I feel like there's a lot of stigma about that image of a soldier, like the strong personality, the hero. And it's really important, because as a person who comes from a country where so many people serve in the military and many people actually go to combat, you can have serious damage if you don't take care of it.
Yeah.
Especially people who went through really tough stuff. So it's important to bring it into awareness, kind of fight the stigma, decrease the stigma, and see that there's a future even if you went through something so traumatic.
Absolutely.
And take care of it, and it's not a shame.
Yeah, it's interesting how you note about how there's the trauma itself, the experience of going into these highly intense situations would be traumatic for anyone, but then you add on this sort of macho man, I'm too tough, and macho women, of course, too.
Yeah.
But people trying to act like they're too tough to experience any of that, hardship and pain. Yeah, and then just to talk from, my perspective as well, why I thought this would be an interesting topic. Of course, I knew that Gal had this life experience and a wealth of knowledge about these things, but I personally have a few close friends and family members who are either previous military servicemen and women, and one of my closest friends is currently enlisted in the United States Army. So for that reason, we just thought it'd be really great to explore this topic for ourselves. Hopefully people on our program may be seeing or listening to this. But yeah, for all these reasons, we really thought it'd be important to touch on. So just to give a little bit more, I'm pulling out my laptop for a little definition here, but just to give a background context, we wanted to talk a little bit about the history of PTSD and how we came to have that term, and also just defining it. So just by a quick Google search, you'll find out that post-traumatic stress disorder is a condition of persistent mental and emotional stress occurring as a result of injury or severe psychological shock. This typically involves a disturbance of sleep, recall of experience, and dulled responses to other stimulus. And of course, we're going to talk about those symptoms a little bit. But you'll note in that definition, that this does not specify specifically a military context, but again, that's what we'll be talking about today. And then to give a little bit about the history of PTSD, the term PTSD, post-traumatic stress disorder, didn't actually come into vogue until the Vietnam War of the 1970s. And as far back as the Civil War, and of course, even before, in ancient civilizations, there was an understanding of the fact that war was traumatic. And Gal, and I, before we had started this, we were talking about how intense it would be face to face with another person. So there's no doubt that this existed. But again, there's sort of a lineage of terminology that we wanted to bring up. So World War I was a famously traumatic war because it was one of the first wars that used mechanized methods of conducting warfare. There's a famous saying that people rode into World War I on horses and they left on airplanes. So what this tells us is that this would be a uniquely traumatic experience for those people who served in World War I. So that's where we get the term shell shock. By the time we got to World War II, it had evolved and changed into battle fatigue. And then by the Korean War, we had operational exhaustion, which then finally one more time changed into the PTSD that we know today. So this just gives a little context on where we are, how we got to this term, and other disorders that it may have been related to.
Cool. That was a lot. Yeah. And again, as you can see, PTSD has such a long history, but only when is this from? Like in the past less than 100
Yeah,
years.
1914 is like World War One.
People started to define things because before that, people were like, I have those symptoms that I'm going to talk about soon, but what is it? What am I feeling? And I feel like as the time goes on and we learn more, we are able to define things. And we know, especially in therapy, sometimes when you give a name to something, it gives you some sort of relief.
Makes sense.
Like, what am I feeling? What is this? So when we have those, suddenly those diagnoses, it gives a lot of validation to many people.
No, that makes sense.
So some of the PTSD symptoms is that you're reliving the event, which means you are awake or asleep, maybe a trigger. So, for example, actually, it's not PTSD, but for me, when I hear an alarm, I'm like, there's rockets coming.
Wow.
Right? That's more maybe like classical conditioning. But for many people, that it's a certain sound that they can hear, like a whistle, maybe there's rockets around, or like a really strong booms noise.
No, that makes sense.
So something can trigger them. Persistent negative emotions, that can be like very overwhelming feelings, that can be guilt, shame, sadness, depression. And again, people can feel depressed because of many, many things. We're talking about symptoms that come together and they have to last for a certain period of time. Like there's a lot of categories into this. Avoidance, that's a common one. So let's say there's a certain situation that reminds the veteran or the soldier about what happened to them, so they will avoid the situation. For example, if there's a place that there's a certain noise that reminds them, they will just avoid going to that place. And if it's not disturbing your life so much, it's not that of a problem. But when it comes to really disturbing your life and the things that you need to accomplish and to meet your needs, that's when it becomes a problem.
Certainly.
Nightmares is a really common one. Let's see, I had a few more here.
Yeah, and it's interesting what Gal just pointed out, that a lot of these symptoms could be standalone. Like, I may be depressed for other factors, but may not specifically be related to trauma. But it's important to note that when we're speaking about PTSD specifically, it's in relationship to either a series of events or a particular event that would cause all these symptoms. But I think that's really interesting that you point out, one that every day, all these people walking by may have certain cues that cause them to do certain things, but it's when it interrupts your life. And then, of course, in the case of trauma, is when it is specifically in relationship to that event.
Yes. A couple more very common symptoms is persistent inability to experience positive emotions, so like happiness, like hope, those kind of things. Feeling detachment from others, from situations, that can come with disassociation.
Right. I was thinking that.
That's a really common one. And then just irritable mood, maybe reckless or self-destructive behavior. It can be problems with concentration, sleep. These are like the main ones. Do you have anything else to add?
No, I think that pretty much covers all of the ones that that you'll typically see or that I've personally seen. And then also things you commonly see depicted in media, movies. So these are kind of the symptoms that are definitely associated with PTSD, I would say.
And we have to separate two diagnoses that are really, really similar. So acute stress disorder and PTSD have very, very similar symptoms. The only difference is acute stress disorder, so from the moment of the traumatic event, from 3 days after to 1 month after the event, that's where you will have acute stress disorder. If after a month you will stop experiencing those symptoms, you won't have PTSD.
Right.
But if you experience those symptoms a month and above, that's where the diagnosis shifts to PTSD. So if a person comes to you and it's like, I've been experiencing this in the past 5 months, it doesn't have acute. It's kind of past that timeline.
Right. That makes sense. And from here, should we jump right into addressing strategies and interventions that we kind of talked about?
Yes.
You ready to talk about that?
Yeah.
All right.
Definitely.
So to open this little section of our podcast, I wanted to talk about this quote that I found from Dr. Gabor Mate, who many of you have probably heard of. He's very much in like the podcast world. He kind of, you know, goes on all types of shows and talks about these things that he's very passionate about. He's an expert on childhood development, trauma, and how these two things can impact mental health outcomes, depression, things like PTSD. But I just found this quote from Mate, who makes sure that people know that the word trauma actually comes from the Greek word for wound. So we can think of a trauma as a psychological wound, something rather than, you know, like a cut on my hands or something like that. It's a cut that's in my mind in a sense. But what Dr. Gabor says is that it's not what happens to you. It is what happens inside of you as a result of what happens to you. It is not the blow on the head, but the concussion I get. So he's saying that essentially it's the way you internalize these events that causes trauma. And I think this actually, it sows a bit of hope in the sense that we know our clients who are suffering from trauma, although the things that happen to them are very serious, and we're not trying to downplay that in any way, but we know that ultimately it's their replaying again and again of those traumatic events that is currently causing the harm. And this gives us a clear avenue on like how we would be able to treat this. And then one other thing that Dr. Gabor says just in this article we were reading is that if my trauma was that my mother gave me to a stranger, that will never not have happened, right? So like if my mom gave me away as a kid, then forever I'll be doomed to this sadness. But he says that if the wound that was I decided as a result that I wasn't worthwhile as a human being and I wasn't lovable. So basically what he's trying to say is that the wound is actually from the psychological interpretation rather than this action that had happened. So again, it gives us a bit of hope, I would say.
Mm-hmm. And I feel like one more thing that we should maybe just briefly mention is that, and it really depends on the culture. And I can tell you an example that happened to me here after I explained the situation. So in many things that we think about trauma, we think about a physical thing. You know, like a physical injury, just like he said, like a cut that actually you can see on your skin. Because, you know, when soldiers came back from fight, they're like, you look fine, like you're very, very, you look like physically healthy, and they were.
Yeah.
But what about the inside?
Right.
And I feel like in some cultures, and I can say that about my experience with the American culture, is that kind of push through the pain, like you're fine. Even if you have a physical injury, like in my experience, they didn't take it as serious. They kind of like, okay, put some ice, you'll be fine tomorrow.
Yeah.
Like, oh, come on, what are you, weak? Like, go back to play basketball as a former basketball player. So if that's the treatment to physical injuries, what about mental injuries?
Right, yeah.
PTSD.
No, that makes so much sense. Like, it's even more so pushed into the back.
Yeah.
And just like, oh, like, I mean, people, like, to me, will say, like, be a man or something like that. And
Yeah, like,
which
stop
means,
complaining.
Exactly. Stop being a baby or something like that.
Yeah, like, you have nightmares, just, like, I don't know, drink orange juice, you'll be fine.
Exactly, yeah. Classic home remedy for nightmares.
Drink orange juice.
Yeah, I didn't know about that one.
Orange juice will fix your life. But
so,
it's just, yeah.
No, I think that makes a lot of sense. Like, it's
Yeah.
very important to, like, remember that in the U.S. culture specifically, I mean, we already, like you said, for physical injuries, try to, like, do the whole be like a man thing.
Yeah.
But even more so, I think, in the case of, like, any form of mental illness, we, of course, often talk about how, like, even depression can be seen as, like, weak character.
Yes.
And when in reality, that, like, doubling, like, trying to, like, squeeze, like, white knuckle your way and be like, no, depression, go away. Like, that's the worst possible treatment, right? So it just would make all these symptoms so much worse.
Yeah, and that's why it's important to acknowledge those things
100%.
and recognize them, because
100%.
sometimes you're like, I don't know what I'm feeling right now.
Yeah, no, that makes so much sense. I agree completely.
Yes.
So with all that being said, do you want to talk about just like a few different modes of therapy that we thought would possibly be good? I know I was personally on team person-centered. I don't know if you wanted to talk about other forms that you wanted. I could talk a little bit about person-centered.
Yeah.
I can go first if you want me to.
I also want to throw some statistics, but I don't know when we should do that.
Let's go to the statistics, and then we'll talk about treatments at the end. Yeah, I like it.
So it's pretty sad. You know, like so 7% of the population of military and veterans will experience PTSD at some point in their lives. Now, I thought I'd actually higher, but when I think about it, it's a lot. It's a lot of people that are being affected, and just think about the circles, right? So there's the the person, the veteran that experienced those symptoms, what about their spouses? What about their children? You know, like it's circles that just not one thing is affected, but many.
Oh, that's true.
Many around it. You had more statistics in there.
Yeah, the other one, I may have gotten rid of it. It was about suicide, and the one, is it right here? Oh, okay, yeah. We had 17 veterans in the United States die from suicide per day, and also 51% of those veterans, that was the one that I wasn't seeing, 51% of those 17 per day, they do not have any form of psychological diagnosis.
Right.
So it shows that there's this complete lack of understanding of the roots of this, of like even screening to understand like who may be at risk. So yeah, all these things are in the United States, and I can assume other places, I honestly don't know. But just this lack of understanding, lack of education on this.
Lack of awareness. This is why it's so important. We talked about why is this important to talk about it.
Here we are.
That's why. Because people don't know, and people are not aware, and if they are, they don't exactly know what that means.
Yeah, not to mention the lack of like systemic interventions and sort of like a social safety net to catch these things, right? So it, in a lot of ways, is a dangerous situation. So with all that being said, you want to hop into talking a little bit about treatments as we kind of wrap up here?
Yeah,
so
for sure.
I come definitely from like a person-centered lens. I really like letting my clients decide what's important for them in treatment, trying to hold that like non-judgmental space, and really just like, accepting the fact that there is sort of a spontaneous element of humans that wants to get better. Like we want to grow, we want to change, and we want to find creative ways around our problems. And then one other thing I think, especially when you consider this depiction of a wound that we talked about earlier, I think, veterans or anyone who's experienced PTSD for that matter, they kind of have this wound in it. It separates them away. They feel very isolated from people just on a day-to-day level. Like they can't trust those who they're walking down the street and passing, or maybe they feel like they even can't trust their own family members because of what has happened to them. And for all those reasons, I think a person-centered approach should be fundamental in addressing PTSD, because this ensures that like we're having that human connection that is so much missing from their tragic experience. And that's why, I thought of person-centered treating PTSD personally.
What I also like about person-centered is that every person's experience is unique, and person-centered allows that space for the person to bring their unique experience.
No, that makes perfect sense. Yeah, and I agree.
So, because usually sometimes like in group therapy, it's like, okay, we're going to kind of treat everyone the same. Like everyone gets the same package.
Sure.
And in individual therapy, it's like, okay, this is what we're going to do. We are going to shape it together, hand in
Make
hand.
your own packet. You
Yeah.
know? It's like, here are the things that are important.
And you're like, you build your own kit. Another intervention or like treatment, intervention is cognitive behavioral therapy, which is like a triangle of recognizing how the connection between emotions, behaviors, and thoughts. So I feel like that's the research suggests that this is a really effective way to treat PTSD. PTSD. I'm just kidding. It's a really effective way to address people's thoughts and emotions and see how it portrays towards their behaviors. Because not always, but sometimes when people have PTSD, they might go into substance abuse or those kind of things. And CBT is really good in those things too. So just trying to understand what the person is feeling, what they actually believe about the thing. Is it true? Is it not? Kind of like reframing, shaping, allowing them to see a different way.
Definitely.
And grow from the trauma.
Yeah, and I think you're right, like kind of trying to like use this model to break the vicious cycle of like something triggers me and then it's like this cascading downward. And I think adding on to that too, like of course there's like the CBT base, but we can also add like a bit of mindfulness into this as well to make it more of like a DBT kind of like the third wave therapy as they call them, right? So again, just trying to recognize like this emergent property that like they have the ability to try and break that cycle, whether it be through learning mindfulness skills, meditating, and things of that nature.
Recognizing your coping skills, what works for you. Other things that I didn't even think about is emotional support animals. And emotional support people.
Right.
People around you that can be effective for your recovery. And to kind of sum it up, we have one question.
Mm-hmm.
So what we thought about is how can we as a society fight the stigma
Mm-hmm.
of people who experience PTSD?
Mm-hmm. Mm-hmm. Yeah,
That get rid of that they're weak, they're not resilient.
Mm-hmm.
Like how can we fight?
Mm-hmm. I believe this question is for our viewers. Is that correct?
Yeah.
Okay, so we're gonna leave it there for our episode. But thank you all for joining us. I think we had a good time and really felt like this was something that we both cared about. So hopefully you took something away. Hopefully there's someone in your life, or maybe someone yet to come into your life who you can use this information to help understand, and just let them know you're grateful for what they went through to try and support us all. So
Definitely. And just to close, if you feel like you're having a really rough time, you can call 988. And then if you want specifically for veterans, you can press 1. And it will take you right through there.
there you go.
Okay. Thank you, everyone. Thanks for watching.
Woohoo.
Bye.
Thank you. Bye.